Hi, everyone. I'm here with Emily Siegel, licensed independent clinical social worker at 413 Theraworks. Emily also works at the VA in New York State. Her experience is supporting clients who have trauma backgrounds and also post-traumatic stress disorder. Today, we're going to be talking a bit about somatic therapy. So welcome, Emily. Thanks for joining
Thank you for having me.
So in talk therapy, traditionally what we hear about is cognitive behavioral therapy, cognitive behavioral interventions. I'm curious if you can share with us what is somatic therapy and how is it used in talk therapy sessions?
Yeah, absolutely. So for somatic therapy, I think it's different than cognitive behavioral therapy in the respect that it's not your traditional talk therapy. I think sometimes when you're talking about trauma experiences, you don't necessarily need to go back and relive every single detail to process through what happened. I think it's a matter of acknowledging that something happened, acknowledging the emotions as they come up, and then finding ways to accept those emotions with curiosity instead of judgment. And then how do you move forward in those?
Yes, I love that. I think there are like two totally different schools of thought when it comes to approaching trauma work, right? Like it's one side that talks about like, we got to pull every single skeleton out of your closet and start at day one and move forward, which can be really overwhelming and terrifying for clients, especially those who like those experiences might not be impacting them as much anymore.
Yep.
And then there's this other school of thought that's like, let's talk about what's impacting you now and how we can help support a change moving forward.
Yeah.
Who might somatic interventions be a good fit for, whether that's like client-wise or diagnosis or symptom-wise? So
I think some somatic practice, somatic interventions can be really helpful for anyone who's experienced trauma. I think it can be really helpful for those who maybe numb or dissociate instead of feeling the emotions as they come up. They often try and like shove them down, put them in a box, tuck them away, and then don't ever go to unpack that box. And I think sometimes that can be a giant battle because then as the emotions come up, it becomes scarier to deal with them versus if you can learn how to accept them and when they come up and then learn the interventions of how to deal with them in that moment, it can make a massive difference.
Thank you. And what do somatic interventions look like? Are you guiding people through like breathing exercises or like stretching their bodies, or what does that look like? What does somatic intervention look like?
I think they can look like a lot of different things. So it can be actual like skills that they learn, the mindfulness, the deep breathing. It can be the self-soothing through muscle relaxation, or it can be the grounding techniques such as heel drops to make you grounded, present in the moment. But I also think it's an acknowledgement of like, okay, I have this anxiety. Where is it coming from? And being curious with yourself about that emotion or anger or frustration instead of judgmental and getting more angry with yourself.
So you're kind of integrating these skills real time in session with clients as some of these symptoms might be coming up for them as you're talking.
Absolutely. Yeah, and in between sessions, having clients make note of what they're noticing when those emotions are coming up. How are they dealing with them? And then bringing them back to session and breaking down, what did you react? How did you intervene? How did you feel in that moment? Where did you feel it physically in your body? And then bringing that back to process down those specific incidents.
Right. How did you get interested in somatic therapy yourself as a provider?
I think for me, it was seeing there's so much research behind the evidence-based practices for post-traumatic stress disorder, for trauma processing. And I think that can work great for some people. But I also think for some people, the trauma they went through was horrible enough that they don't want to go back and relive every detail. So they're trying to figure out how do they move forward and not have that trauma define their life, but how do they move forward? Because I'd be lying to say anybody's going to go back and be the exact same person they were before that traumatic event happened, right? But it doesn't mean that whatever happened to them defines who they are for the rest of their life. So how do we accept that? Say, yeah, that was horrible. That was awful. That never should have happened. But then how do we move forward when our body remembers, our nervous system remembers the things that happened in ways we may not realize, but then how do we accept those and move forward?
Thank you so much.
Absolutely.